السلام عليكم. يعطيكم ألف عافية. Good evening, everyone. Thank you for your time to attend one of the best professional development webinars. Thank you to the Faculty of Public Health and the College of Medicine and Health Sciences in UAE University for always providing us with these opportunities. My name is Aseel Al Hawari, a recent graduate from the Public Health Master's Program, and I'm delighted to serve as the moderator for today's session. On behalf of the Institute of Public Health, I would like to thank you all again for joining us for this important and timely webinar entitled Planetary Diets and Policy Pragmatism, Lessons from the UAE. At the Institute of Public Health, we remain committed to creating platforms for meaningful knowledge exchange, interdisciplinary dialogue, and professional development through our scientific webinar series. This webinar is a part of the global This is Public Health initiative, which aim to highlight pressing public health issues and inspire action through education, research, and collaboration. We are also proud of our affiliations and collaborations, including ASPHERE. Before we begin, I would like to share a few housekeeping notes. First, we encourage you all to engage actively during the session. If you have any questions for the speaker, please write them in the QA section, and we will address as many of them as possible during the discussion period. Second, this webinar is being recorded. Don't worry about this, and the recording will be made available through the Institute of Public Health channels, YouTube, and many channels for those who wish to revisit again or reshare it again with others. Third, this webinar is accredited to CME credits. At the end of the webinar, a link will be shared for evaluation. So please keep to the end and fill this evaluation. We kindly ask all participants to complete the evaluation form to receive their certificate CME credit documentation. It's now my great pleasure to introduce today's distinguished speaker, Dr. Mira El Ghaziri, Managing Director of HealthyPath, United Arab Emirates. Dr. Mira El Ghaziri brings valuable expertise and leadership in the area of nutrition, health system, and policy. And we are honored to have her with us today to discuss an issue of growing relevance at the intersection of nutrition, sustainability, and public health policy. Today's presentation, Planetary Diets and Policy Pragmatism Lessons from the UAE, promises to offer important insights into how dietary patterns, health, sustainability, and policy can come together in practical and context-sensitive ways. Dr. Mira, thank you for joining us today. The floor is yours.
Thank you so much, Aseel. And thank you for the faculty of the Public Health Department at the UAE University for inviting me to be part of the Public Health webinar series. It's really my honor to be part of this series. And it's a great initiative that you are disseminating the knowledge about emerging public health initiative and public health topics in the UAE and beyond. So let me just share my screen first. I don't know if you can see my screen. Just checking with Aseel if you can see it. Yeah.
Yes, I think Dr. Mira, yes.
Great. So thank you again for the introduction. Again, it's my honor to be here today. Just also a quick introduction about myself to the audience. So As you rightly introduced me, I run a consultancy firm called HealthyPath, which is a nutrition policy and food sustainability consultancy firm. So we work across the key stakeholders, the private sector, the food industry, specifically the retailer, but also the government and academia to see how we can drive a healthier food environment through the right policy change, but also the right and needed initiatives. So I've been running the consultancy firm for the past few years. And before that, I've been working, I worked extensively first in academia as a researcher in the nutrition department and health, and later on in the nutrition and food regulation and policies as part of the private sector and the food industry. So I come with a background understanding both academia and the science background, but at the same time understanding the pragmatism and where food industry sits in. My background is initially nutrition, and recently I completed my master's in global health policy at London School of Hygiene and Tropical Medicine. And what I will be sharing with you today is basically part of the research that was conducted as part of my thesis, which is recently published or approved for publication. So what I will be shedding on today for the audience is basically looking at the UAE food consumption patterns and to what extent are they aligned or divergent from what we consider healthy, sustainable dietary patterns based on the key examples. So basically, to what extent they align with diets that are good for health, but also good for the environment. And what are also the existing policies or the policy gaps that support or not this transition towards healthy, sustainable diet? And where do we need to really go from there to really accelerate the agenda on that direction? So just to start, obviously, today we live in a country, we are blessed to live in a country that is considered one of the most food secure countries in the region. And this is thanks to the leadership that has prioritized food security and that put the needed emergency plans whenever there is any new crisis. However, one area that is not yet heavily discussed in the region and in the UAE particularly is the implications of what we eat. So every time we make a decision to eat certain meal or to have certain plate, we participate all together in a system that shapes two futures: the future of our health, but also the future of the environmental footprint that we will be leaving.
Dr. Mira,
Yes?
just can you make it full screen, please?
Okay. It's not full
Okay.
screen.
Yes.
Okay, just
Thank
a
you. Thank
second.
you. Thank you, sir. Thank you.
Okay, 1 second. Just a second. Sorry. Just allow me 1 second. I don't know if you can see it now.
Yes, Dr. Mira. Thank you. Thank you very much.
Great. So this is where, this is the intent today of the session. Today, I'm gonna be taking you through what people in the UAE consume, and I'm gonna be showing you data and the policies that we need to improve the situation and basically to transition or accelerate the transition to healthy, sustainable diet. And basically, the key highlight is to showcase to you that and emphasize that the diet is not just a health issue. It doesn't sit only in the sphere of the health sector, but it's also a climate story that also comes across different sectors. And the way we're going to do it today, I'm going to give you first just a quick context of where we stand today, what are the global direction and the global development, what are the example of sustainable dietary pattern, and also zooming in particularly to the UAE context when it comes to health and the food security agenda. And later, I'm going to be sharing with you the 2 research papers that I've been working on as part of my thesis paper. We're going to take you through the methodology and, of course, the result. And at the end, I'm going to share with you more the policy implication, what does that mean to the UAE and the broader GCC region before coming up with the conclusion and the recommendation. So first, just to start with the food system, just to give a context and recap about what is food system. Today, all the evidence say that the food system is one of the key contributors to climate change and environmental degradation. Today, the food system, the way we produce food, the way we consume food, contributes to 1/3 of the global greenhouse gas emission. 1/3. And the livestock sector alone contributes to 18% or nearly 1/5 of these global greenhouse gas emission, but also contributes to extensive land use, which is 80% of it. So agriculture and the food system is the key driver for the environmental degradation that we are seeing today. And we're seeing this, especially the greenhouse gas emission, across the whole food value chain, spanning from the land usage, production, packaging, wastage, all of that. And when we also zoom in more into the agriculture, we see that it's not only a primary driver for climate change and greenhouse gas emissions, but it's also a key driver for the freshwater usage, because we know that with the agriculture, it uses more than 70% of the global fresh water. At the same time, with the agriculture, you end up using more than 50% of the habitable land. And other than the agriculture and food system is contributing to climate change and environmental degradation, today we are witnessing how the climate change is also it's getting worse year on year. And we know that this has gonna have negative implication on the food insecurity and the agricultural productivity on the longer run. It's important to be mindful that when we talk about food system, it's quite complex. It basically the entire ranges of actors across the whole food value chain, starting from first and foremost, of course, the farm and the food production. So that means the crops, the livestock, fisheries, but also going to the distribution and the packaging and transportation up until consumption and disposal of food. So this is the food system. It's quite complex because you cannot pinpoint to one specific area, but it's really the aggregation of all of these actors together. And it also includes the enabling policy, environment, and cultural norms around that food system. Now, one key area that I would like to shed the light upon today is one of the key reports that emerged from the Environmental and the Climate Change Summit is the IPCC report, if you're familiar with it. So basically, this report is a key report because it's basically produced by the UN body, which is Intergovernmental Panel on Climate Change. And usually it's the most trustworthy report because it talks about and provides data about the implication of climate change from science perspective. It also sheds the light on the impacts and the risk for people and ecosystem whenever there's climate change. And it also provides direction on what are the ways and options to cut emissions, which is mitigation, but also to manage risk, which is adaptation. So the IPCC panel, they looked at different options that have the biggest impact on reducing the impact of climate change, or what we call mitigation options. These are some of the options they looked into it. However, there is a bigger exhaustive list on the mitigation options they looked into. So some of the mitigation options they looked into is, for instance, carbon sequestration or forest management or food loss and waste. And they look at what would be the mitigation to reduce climate change impact. The interesting part is global transition or the shift to sustainable, healthy diet has substantial climate change mitigation and adaptation potential by reducing the emissions every year by 2050. So you can see here the quantities or the amount that has as a potential. The reason I'm sharing that with you is most of the time the focus is on the other elements or the other options like carbon sequestration, all of that, food loss and waste. But here what you can see is that transitioning to healthy sustainable diet has actually a bigger impact than even reducing food loss and waste or reducing the use of fertilizer. But it's just not studied enough and quantified to be more, I would say, disseminated. So this is where the opportunity to really elevate the topic of transitioning and improving our ways of eating that can have a huge implication on climate change mitigation and adaptation. And when we also look at the existing evidence and the emerging evidence as well, when we look at specific types of foods, particularly animal-based food and ultra-processed food, they are seen to have the highest greenhouse gas footprint, land use, and water consumption. So again, although usually we talk about ultra-processed food from health perspective, how they have a huge negative implication, but at the same time, they also have a big environmental footprint, whether that relates to greenhouse gas emission or the others. And the same with the animal-based food, particularly the livestock sector, which as I shared before with you, it contributes to around 20% of the greenhouse gas emission and 80% of the land usage. Adding to that, sugar production is also linked to biodiversity loss, soil erosion, and freshwater pollution. So you can see here the impact of the diet and what we eat is not just on our health, but also on our environment. And if we zoom further into the impact of animal-based food, so you can see here that not all food are equal in their emission. Beef, particularly, and to some extent as well, the lamb and mutton, have the highest contribution from greenhouse gas emission. Now, when you compare that to other animal-based foods, such as poultry, fish, eggs, you will see that these latter food options have way less effect than beef and lamb. So this is where it's important to be mindful that not all food are the same, and not all animal-based food contribute to environmental degradation. That's probably a misconception. And then when we go in the bottom of the graph and we go more to vegetables and legumes, you can see how the impact on climate change or greenhouse gas emission is way less than the beef and the first two options. And that's why, because of the recognition that shifting to healthy diet from sustainable food system is so important to reduce the greenhouse gas emission and basically decelerate the climate change and enhance biodiversity. That's why the UN, the first United Nations Food System Summit back in 2021, aggregated all of the countries together and had a very clear call to action for all countries that we need to shift to a healthy diet from sustainable food system to achieve sustainable development goal by 2030. And what was clear from that call to action in that shift is that such dietary transition are very important for critical agreement and accord that relate to climate change and climate mitigation. Particularly the 2015 Paris Agreement, which was sort of a key landmark when it comes to climate accord, but also the United Nations COP28 and all the subsequent COP that you may be familiar with. So this was the first time that transitioning to healthy sustainable diet was really recognized. However, it's important to be mindful that it's not that easy to transition to that direction. Why? Because there has been several efforts to translate sustainable diets into policy that have been quite patchy and not successful. So, and this is because a lot of time they may be facing political and practical challenges at a global level. It's important also to be mindful that the policy-making process to transition to such diet and food system is quite inherently political. Because at the end of the day, you need to target the livestock sector. You need to target the food companies that produce ultra-processed food. And we know how that can be quite challenging from political point of view to really come up with the needed policy change. And at the end, the last part is also, up until now, there is no clear consensus on what are the most effective policy tools or instruments that can really drive that transition and accelerate that change. Now, when we look at healthy, sustainable diet, it's important, you may be asking yourself, okay, what is healthy, sustainable diet, right? I think everyone may have his own interpretation or the definition of what does that mean for him. Now, FAO and WHO, they provide a clear definition on what does that really entail. And dietary patterns are those that promote all dimensions of individual health and well-being. So first and foremost, they address the health part. Secondly, they have low environmental pressure and impact. And thirdly, they are accessible, affordable, safe, and equitable. And the fourth element, they are culturally acceptable. So if you remove any of the four elements that I just mentioned now, then it's not really a healthy, sustainable diet. So we need to make sure the diet is anchored in the social norm and the tradition of the country. We need to make sure that the food is affordable and accessible and safe to most of the population. And we need to make sure that it's healthy and it is really having a lower environmental footprint. And two examples of healthy, sustainable diet models emerged in the past years. The first and foremost is Eat Lancet Planetary Health Diet. So what is the Eat Lancet to start with? The Eat Lancet Commission was released back in 2019. And this commission was an aggregate of around 40 scientists that operate across different sectors, be it nutrition, agriculture, culture, sustainability, political science. And they all work together to come up with some sort of planetary targets or a target for what is a healthy, sustainable diet. And in that diet, what they came up with is that they put a big emphasis on plant-based food, less on red meat, and they really focused on the consumption of particularly whole grain, legumes, nuts, fruits, and vegetables, both because from the health perspective, but also from the environmental perspective. And they also promoted that we need to minimize sugar, refined grain, and ultra-processed food. And the whole intention is to really address the nutritional, but also the environmental direction. On the other hand, the Mediterranean diet is a diet that has been existing for years and years. And it's obviously a diet that the basis of it is rich in plant foods, olive oil, legumes, of course, limited red meat. And there's extensive evidence that this is associated with the reduced risk of non-communicable diseases, but also that it has an impact on reducing the climate impact, particularly greenhouse gas emission, based on different studies across the Mediterranean countries. And this is just an example for you to get a sense of the Eat Lancet Planetary Diet. So here you can see on the left-hand side that they came up with targets and specific criteria for each of the food category that I just mentioned. At the same time, you can see on the right-hand side, they didn't only come up with recommendation for the diet, but they also came up with a recommendation for what we call food transformation or the great transformation. Basically, this great transformation comes across three areas, which are dietary shift, sustainable food production, and addressing food loss and waste. And across all of these three areas, there are 5 key strategies. So the key recommendation or strategic direction on the dietary shift is basically to ensure we have accessibility, affordability of healthy, sustainable diet across different key policy tools such as taxation, subsidies, label, reformulation, all of that. The second area is sustainable food production. So they put basically key strategies and basically the strategic priorities under each one. The first strategy is all about reorienting agricultural priorities to produce more nutritious food. So that basically entails to have more agricultural crop diversity, invest in agricultural research to see what potential crops we can also have, but also providing incentives to farmers and small-scale farmers to produce more nutritious food. So that's all about supporting and producing more nutritious food. Strategy 3 is all about sustainably intensified food production while being very conscious about the natural resources used. So this is all about leveraging precision agriculture, leveraging agricultural practices that improve soil health, is quite conscious about the water and the land, and that also adopt different technologies such as carbon sequestration. And the third aspect of sustainable food production is all about the governance of land and ocean. So this is all about how to ensure we have zero expansion policy on new agricultural land, and there is also specific ethical and code of conduct on how to basically address the fisheries. And the last part is food loss and waste, basically reduce food loss and waste by half by 2030, which is again aligned with the UN Sustainability Development Goals. Now, zooming into the UAE, where do we stand and why having a healthy, sustainable diet is critical? It's important to be mindful that we still have a lot of health issues today. Obviously, there is a big progress for the past 10 and 15 years from the government to really address the obesity and non-communicable diseases. However, we still have quite, let's say, alarming rates when it comes to obesity and cholesterol, etc. And this is based on the latest national survey for health and nutrition that was just issued by Ministry of Health and Prevention earlier this year. And some of the key dietary behaviors that are driving this burden is obviously still the over excess of intake of sodium, of fat, to some extent the sugar as well, and also the sugar-sweetened beverage. Now, when we look, other than the health sphere or the health context, it's important also to see where do we stand in terms of the food security agenda. So obviously food security has been always a concern in the UAE and the broader GCC region for the obvious reason. Obviously, the country is characterized by tough environmental conditions, which makes it quite reliable on food import. And there are quite projections that the temperature will keep on increasing by 2040. And this is also then adding a lot of pressure on the food production. At the same time, we tend to have different global disruptions such as COVID, Ukraine-Russia war, and just recently the recent war, which has a huge impact on the Strait of Hormuz, which has a huge consequently impact on the food and the fertilizer and the whole food security again. Now, the great story is that the government and the leadership has been really prioritizing food security to ensure we have food in the UAE across all seasons. And this was also quite obvious with the National Food Security Strategy back in 2018, and also when they hosted COP28, which is the most important conference for climate change here in the UAE. And that was also obvious in the different sustainable agriculture and agri-tech initiatives that they've been driving. However, one thing that is still, I would say, missing or critical gap is, despite all the investment in food security, still we see less emphasis on changing dietary consumption pattern to be more aligned with health and climate, and that we still don't see nutrition and health quite integrated in the food security strategy. And this is where this study really matters, to really go from evidence to action in the GCC region. So as you see, the core problem is that the UAE faces a dual burden when it comes to the NCD, but also, of course, the high environmental impact of the food that we eat today. And despite strong food security strategy, again, dietary consumption is still unaddressed in sustainability efforts. And this is why in this study, we look at to what extent dietary patterns are aligned with globally recognized sustainable diets, and what policy gaps do exist, and what will it take the UAE to transition to such diet. And why this is important for the GCC as a whole. First, UAE served as the regional benchmark for food policy and innovation. And secondly, we know that all the GCC region have similar dietary pattern and environmental conditions. So whatever is an outcome for the UAE can be quite useful for the rest of the GCC market. And finally, this will help position dietary change as a lever for climate mitigation, health improvement, and food security. So not only health, but also the other 2 points. So this is where in our study we looked at, we had basically 2 objectives. The first objective was to assess dietary alignment. As I mentioned before, we wanted to evaluate the current UAE dietary pattern and to what extent they align with global healthy sustainable diet, which in that case were the Eat Lancet recommendations that I just shared with you, and the Mediterranean diet. And the second one, we wanted to understand what are the policy framework that exists today in the UAE to support such transition, and what are the current gaps that we need to work on accordingly. So the first objective is assessing dietary alignment. So in this one, we wanted, as I mentioned, to assess the alignment. And in this one, we had, as a methodology, we had 3 basically areas. So we looked at the literature review from 2012 to 2015 to see what does the evidence say about what people eat in the UAE. The second one, we took data from the UAE dietary intake and we compared them to Eat Lancet and looked at the percentage deviation across all the food groups. And the third aspect, because we realized that there is not enough studies at the time of the study, we also relied on food supply analysis, particularly FAO stat, to also give us a direction on what do people eat and what is the trend across the years. So this is basically the first objective, which was literature research. We identified a total of 485 publications, but after scrutinizing it to be basically for relevance, we ended up with 14 eligible studies. Only 1 study in the UAE assessed the environmental impact of the UAE diet. All the others, they looked only from the health perspective, and none of the studies benchmarked against Eat Lancet recommendation. This is just to give you an idea of the review of evidence. And the key findings from this review of studies was the following. So 9 out of 14 studies focused on the dietary habits of children and adolescents, and the rest were for the adults. And what is clear is that for the fruit and vegetable across the studies, there was quite consistency in the inadequate fruit and vegetable intake. So here you can see up to 72% of adolescents failed to meet the recommended 5 daily servings of fruit and vegetable, and the same is seen also among adults. When it comes also to the legumes, we also saw low intake of legumes among adults, and this also translated to significant deviation from the Mediterranean diet, but also the Eat Lancet. And this dietary pattern also translated to a lower intake of fiber, which we can see as well among children and adolescents. When it comes to sugar, we saw also that 70 to 90% of children exceeded the WHO recommendation, with around 40% consuming sugar-sweetened beverage. And when it comes to the fat food consumption, it was also high both among children and adults. And the last part is the meat intake among adults was quite substantial, with around 70 and 22%. So basically 70 and 22% of the population consuming white meat and red meat on a daily basis. And when we looked at the gender and the nationality discrepancy, we saw that Emiratis consume more red meat than non-Emirati, and men consume way more meat than compared to women. So here you can see differences by nationality and gender. The second thing is we took the data from from one of the studies that assessed the environmental impact of the UAE diet, and that also described the low adherence of women in the UAE when it comes to the Mediterranean diet. So what we did is we took this data that was compared to Mediterranean diet, and then we compared it in our turn to the Eat Lancet recommendation. So we did a comparative analysis, and what we also saw, we saw marked diversions from the recommended sustainable diet. So when it comes to positive nutrition, for instance, whether it's whole grain, fruits, legumes, and nuts, you can see there's substantial deviation from the recommendation, whole grain being markedly low, but also nuts as well, and as well as legumes. Fruit intake showed the smallest deviation with 12%. In contrast, animal-based food, the one in the red, they were substantially exceeding the recommended threshold, with red meat and poultry intake showing large deviation from the norm, and egg intake also exceeding the recommendation. When it comes to added sugar, it has the biggest deviation, showcasing extreme overconsumption relative to the target. So these findings align with the study of Naja, Professor Naja, back in 22, and basically highlighting that we are a bit divergent from what is considered sustainable diet. Now, the second part we've done is the following. Because there was not enough or there was limited availability of studies and no national dietary intake at the time of the research, which was up until 2025, we also looked at the food supply database from Abu Dhabi and the UAE. And we looked at basically we compared the mean daily intake across all of the different food categories, and we compared it again to the Eat Lancet recommendation. And again, whether at a national level or local level, so Abu Dhabi, again, the message was the same. The UAE population tends to have a supply around 4 times the amount of beef and poultry, and also the same with Abu Dhabi. And when it comes to the plant source food, we also saw that the UAE at the national level, it was 76% below the recommendation, and at a local level, it was 94% below the recommendation. Along with that, we wanted to also analyze the food supply from FAO-Stat with trends in the supply. So we wanted to see the trends in supply from the import or production of animal to plant-based food, and also the trend in per capita protein supply from 2010 to 2021. So we really wanted to understand what's happening for the past 10 years. Are we supplying more animal-based food, more plant-based food, more red meat? So, and here again, we see that when we look at the food supply, that there's a sustained increase in the supply of animal-based food in the UAE over 10 years. And that was driven mainly by growth of 2 categories, dairy and meat availability, compared to that of plant-based food. The same, continuing with the FAO-Stat trends in food supply, this time we looked into the food import of meat. So we also saw here that import of meat nearly doubled from around 378 to 796 between 2010 and 2021. And the same for the milk import, it increased by 2.5. And when it comes to the protein supply quantity, which is usually grams per capita per day, we also saw that per capita protein supply from animal sources nearly doubled during that period from 25 to 58, whereas the plant protein supply sort of has an increased modest. So the key findings here are the following. We can see here that the UAE diet diverged markedly from sustainable diet and recommendation, and this is driven by the low intake of plant-based food and high intake of animal-based food. At the same time, this is consistent with findings from other GCC countries like Saudi Arabia and Bahrain. And also, the high meat intake is consistent with high-income countries. You can here see in the graph, small graph, how UAE consumption of red meat is quite similar to European countries and also to countries like Canada. So here I would like to close on this section with few points that there were some key barriers and areas to consider in that presentation. First, it's not easy to shift a whole population to a unified planetary diet when you have such a diverse population. Two, the UAE consumption for red meat that is quite beyond Eat Lancet suggests that we may need a behavioral change approach supported by policy and intervention. Thirdly, we need to consider the cultural and socioeconomic actors that shape food choices. So it's important to be mindful that Eat Lancet the recommendations are quite low by default because its main focus is environment, whereas Mediterranean diet is quite originating from tradition. And when it comes also to shifting to a healthy, sustainable diet, we do need to have more comprehensive policy instruments that reshape the food environment. Because at the moment, there's still limited use of comprehensive policy instruments and uncertainty about the most effective and politically feasible policy one. And this is just the paper that got accepted in Frontier Journal with all of the professor from London School of Hygiene and Tropical Medicine, but also from different universities in the UAE. Now, the second paper, as I mentioned, has more a policy angle. So in that one, we really focused on, so the focus was really to identify what policy frameworks exist today in the UAE to support a transition toward a healthy, sustainable diet. And here there were two key areas for the methodology. The first one, we did policy review of all national documents across different governmental entities, such as Ministry of Climate Change, Ministry of Health, Ministry of Industry, and so on, and also local entities. And then what we did, we looked at these policies and assessed them against the 5 Eat Lancet strategies that I shared with you, and also across the 3 pillars, which are dietary shift, sustainable food production, and addressing food loss and waste. The second aspect, after understanding and mapping the policies, we also conducted in-depth interviews with key stakeholders from key national and local entities. So basically, we interviewed them to really understand what is the current perception of policy priorities, to what extent they align with food security versus health, and what is really needed. And based on these interviews, we conducted a policy analysis guided by the policy analysis triangle. So basically, we looked at 3 to 4 factors. We looked at the key dimension of this, which are context, process, actors, and content. For the policy context, basically, we analyzed what are the influencing factors that drive the current situation. So what are the hindering and the barriers across to really drive this shift. The second one is we looked also at the policy content. So we wanted to understand the likelihood of policy adoption and what could get into the governmental agenda. And to do that, we looked at different policies by examining 3 key areas: the importance of that policy on the governmental agenda, the feasibility to apply it, legitimacy, and also if it has the support to make it happen. And then we put some sort of scoring on what are the most important, legitimate, and feasible policies to be implemented to really drive a change towards a healthy, sustainable diet. And lastly, we looked also at the actors or power actor dynamics. We assessed this to help us understand what type of power is exercised by different actors and what is the ability to influence the decision-making in that policy agenda. And these are the following basically results. So when it comes to the first objective of that paper, which is the policy review, we identified 21 national policies and strategies related to food system sustainability between 2018 and up until February 2026. And these strategies, or 21 documents, they cross-cut across different governmental entities. The main one goes to the Ministry of Climate Change and Environment, but also 2 policies go to the Ministry of Health and Prevention, and then 2 to the Ministry of Industry and Technology. And then you will find sporadic documents, 4 that cross-cut across different Abu Dhabi local entities, as well as 3 other documents that also goes into federal government. And here you will find the distribution of policy effort when comparing it to the Eat Lancet pillar. So obviously most of the policies we saw goes into the sustainable food production pillar of the Eat Lancet. But also we saw a big chunk that goes to the dietary shift, and to some extent as well, there's a big focus as well on the food loss and waste. These are just a quick screenshot of the documents. So now I'm going to just give you a bit of assessment of the different policy documents and to what extent they align with the Eat Lancet recommendation. So when it comes to the dietary shift, which is the first area of the Eat Lancet, we were able to identify 8 policies. You can see here the policies. So for instance, the National Nutrition Strategy by Ministry of Health, the tiered excise tax on sugar-sweetened beverage, policies around the school, for the well-being. So all of these policies sit in the area of health. And what we realized is that we saw that although these policies, a lot of them, they've been existing for long, but what is very obvious is that from 2024 and 2025, the nutrition policy agenda has really accelerated. And this is, you probably saw what's happening in Abu Dhabi, like the Nutri-Mark. There's updated tiered sugar-sweetened beverage taxation, advertising restriction, school restriction. So we can say that from 2018 up until 2024, it was a bit on a stall mode. But 2024 onward, the health agenda really took off. But one thing to keep in mind that all of these strategies and policies are anchored in public health frame and not integrating sustainability aspect. So health is first and foremost a key priority. When we looked also at the national frameworks like the well-being strategies or the dietary guidelines, at the moment they do not tackle environmental sustainability into dietary guidance. And commitments like the COP28 Declaration on Food System, it does tackle or acknowledge the importance of sustainable diet. However, there's no clear implementation process. So this is for the first part. The second part is assessing the UAE documents against the sustainable food production pillar of the Eat Lancet. Here we identified 12 policies that cross-cut across 3 strategies, which again, the first one is reorienting agricultural priorities to produce healthier food. The second one is to be more conscious about the resources. And the third one is the governance for land and ocean. And what we saw here, that most of the UAE focus is directed toward the strategy number 2, which is increasing production of nutritious food. And this is basically through different policy documents like National Farm Sustainability Initiative, the COP28, Plan the Emirates, National Food Security Strategy, and so and so. And here you can see that the big focus is really to support a localized food production, ensure self-sufficiency, and support small-scale local farming. Now, here it's important to mention that there is some tension between this policy and the Eat Lancet, because the strategy which is related to the industry and advanced technology, they prioritize livestock sector as a key sector to invest in and localize. But also we know that livestock sector has an implication on the environmental and the land users. So here there is some contradiction and misalignment with the Eat Lancet. The second part, when it comes to strategy 3, there is a big focus as well from the UAE to ensure that we are more conscious about the resources. And this is quite evident from climate change, UAE climate change plan, the UAE green agenda, the water food security strategy. All of these strategies, they really support on reducing greenhouse gas emission, building climate resilience, and also ensuring that we have lower environmental footprint. And the third strategy, which is all about governance of land and ocean, here there's only one main policy about that, which relates to the fisheries. And here the policy focus is to reduce pressure on fishery. However, it's important to mention that there is no integrated terrestrial marine food governance when it comes to that. And at the moment, this is still not quite aligned with the Eat Lancet because the Commission or Eat Lancet caution that aquaculture expansion must be accompanied by managing the risk anticipated with such risk. The last part when it comes is the food loss and waste. Here it's quite evident that there is a clear commitment to address food loss and waste across 5 policies. So here, these are the 5 policies that we identified. One of them, the National Food Security Strategy, where it mentioned very clearly the importance to address food loss and waste, but also other strategies as well. And here it's important to mention that there is strong policy alignment on reducing food loss and waste, and there is quite coordinated national and emirate level actions. Now, when it comes to the stakeholder interviews, here, these are, so basically we interviewed 7 stakeholders. These are the stakeholders we interviewed to understand the policy prioritization. So you can see there are governmental actors, non-governmental organizations, commercial actors, but also global actors. And what we saw as in terms of policy context, so what are the enablers and hinders of policy change to really drive and shift toward a healthy, sustainable diet. So from the interviewees across these respective 7 entities, what they made it very clear as enabling factors to really accelerate change is that structurally, UAE is a regional and global hub for food trade. So it just makes it easier to really drive a change. Secondly, the presence of multinational corporations is also an enabler by bringing expertise and technologies into the country and really bring the knowledge know-how. And the last part is really the political will, visionary leadership, and the speedy process to implement policy change whenever it's issued. So these are some of the enabling factors that are seen can help drive a policy change. On the other hand, there are some barriers that were mentioned by the interviewees that could be also a stopper. So some of them is the crisis. A lot of times we have imminent crisis such as the pandemic and just recently the new war that can reshuffle the priorities on what's important. Secondly, of course, there's diversity, the challenging environmental conditions to produce fresh produce, but also diversity of the population, as I mentioned before, to really implement and drive a unified, sustainable diet. And the last part as well is culturally, changing population's perception and behavior around food is not that easy. And we do have a meat-oriented society and the culture of surplus. And here you can find just a quote from Mohab at the time on how dependent we are on animal-based food intake and how difficult is it for us given the cultural and the hospitality that we have. Another part of the policy making analysis is the policy content. So what policies could be driven according to the interviewees across the 7 entities that can drive a change. So basically, we looked at different policies such as reformulating food, innovating more in plant-based food, facilitating trade so it's more aligned with health and sustainability, taxing unhealthy and unsustainable food, and implementing ecological labeling, and finally, awareness campaign. So the key highlight from that is you can see here basically categorization of those with the highest score that are in green, those that are medium in amber, and those that have lower interest in red. What we can see here is that reformulation, which is the first policy, got the highest perceived importance. However, it had the lowest support needed at the time. I need to just mention that the interviews were handled back in 2022, so things may have changed since then. But it's important to mention that at the time, reformulation was not seen as something that gets the support to really drive a change. The two other suggested policies are the taxation of unhealthy and unsustainable food and reduction of trade not supporting health and sustainability. These rank the lowest on feasibility, legitimacy, and support. Trade, for the obvious reason, is because the UAE is seen as a regional hub for trade, and they don't want this to impact the trade and basically the economy. And when it comes to taxation of unhealthy and unsustainable food, basically this is given the potential of food industry's opposition to such direction. The third part is incentivizing plant-based food consumption. So that was also seen as a policy more realistic alternative than taxation. However, this says also there's some issues about the legitimacy and the feasibility of that. On the other hand, public awareness campaign had the highest feasibility, legitimacy, and support. So all interviewees suggested that awareness campaign should be number one initiative to shape the demand, especially when adopting a whole of a society approach. And the food industry was quite supportive of that direction. The last part I'm just going to mention very quickly here is we also looked at the power dynamics based on this interview to see which of these stakeholders, be it academia, food industry, Minister of Climate Change, Minister of Health, and UN entity, which of these entities really is perceived as knowledgeable and collaborative on the topic of driving healthy, sustainable diet. And what came out from this is that the most knowledgeable actors on the topic were Minister of Climate Change and World Wildlife Nature, which is an NGO, at the moment of the interview, which was 2022. MOHAP and the food industry had a medium level of awareness and collaboration at the time, while academia and civil society group rated low on both fronts. So this again showcased the need to probably elevate further the role of academia and civil society group to be more seen as a driver and collaborative on catalyzing the policy change on that front. And when it comes to the role of the food industry as a private sector, the interviewees had divergent views about the role of food industry in the UAE. So some stakeholders saw that it's very important to have a proactive pathway with the food industry. This is because both multinational corporations and small medium enterprise can really transform the food system, and they are seen as an integral actor to really drive collaboration. On the other hand, some stakeholders saw that the food industry might be less inclined to collaborate on this topic, and they have a tendency to oppose nutrition-related policy. So what is clear from the second... Yes.
Just to notify you, this is 8 a.m. I had 8 p.m. now.
I know, yes. I'm really sorry for that, yes.
Thank you.
Yeah. So here's just... Yeah, I'm just going to close before the questions. So here, just to showcase that, obviously from the second paper, there is a strong focus on food production and self-sufficiency, as you can see from the different policies that I shared. And the nutrition agenda has really been accelerating since 2024. But it's important to mention that there is still no reference to planetary diet in any of the national policy. So here, just a conclusion I want to leave you with is that transitioning to a healthy, sustainable diet that consider all the natural resources, the cultural habits, social norms, and population health is critical. And the diet that relies on plant-based food, sustainable food system has considerable potential to mitigate climate change and enhance food security, but also improving health in the UAE. And this is where we have, there could be some of the recommendation that to really drive the needle on that is to, again, tackle the food environment to address the availability, accessibility of healthy, sustainable diet through the key policy instrument that we need. Reducing also the consumption of animal source food by coming up with the right awareness campaign that can address the intrinsic belief around the red meat, empower civil society groups and academia to come up with more research for evidence-based approach, and gather more evidence about the dietary intake in the UAE and the environmental impact of the current diet, and of course come up with interventions that are culturally grounded in science. And with that, I would like to close. Thank you so much for your attention.
Thank you, Dr. Mira. Thank you for your time. Thank you for, okay, now it's my camera. Okay. Thank you. I really appreciate your presentation. From my side, I gained a lot of new knowledge, especially about the connection between food systems, climate change, and policy gaps in the UAE. We will now move to Q&A questions section. I would like to invite all participants to submit their questions through the QA box if they have not already done so. Thank you, Dr. Mary. Again, I will check that question one. Okay, we have received several questions. Excellent question from the audience. The first question about the behavior you mentioned before and the society. This is a good question. She asked you about, do you think awareness campaigns alone are enough, or do we need strong regulator approach? What do you think, Dr. Mira?
Yeah, obviously, campaign alone is not enough. We know knowledge alone is not enough. We need the right structural determinants of health, the right upstream factors to really make a change in the society. And I always give the example of, like, I think most people know that eating fruit and vegetable is healthy. I don't think anyone can negate that fact or can think other way around. But the reality is today, people know the fact that they need to eat more fruits, but still most people don't eat fruit and vegetables. So awareness is something, but it's complementary to other instruments, which is we need to have the right policy to drive consumption toward that. We need to have policy that makes this food more affordable, more appealing to grasp from the retailer shelf, more tastier as well, because there's also this misconception that healthy and sustainable food may not taste as good as other types of food. We need to also put the right subsidies that support the direction toward that. The right taxation that disincentivize going for the unhealthier and unsustainable, and to have the labeling that supports empowering them to go for these directions. So we need to have also, along with the awareness, the right policy tools to support towards that direction.
Thank you, Dr. Mira, to be clear and for the informative knowledge. Other question about, you mentioned before about policy and implementation. So they ask about how can we better integrate health and environmental sector, since currently they seem to operate separately. What do you think, Dr. Mira?
Yeah, that's a very good point, because that is one of the main challenge when we bring together the nexus of food when it comes to health and environment. The people who operate or work on national dietary guidelines or on health, they only work in the sphere of health. And those who operate and look at the environmental aspect of food, they only look at the aspect of environment and climate change. And there's no one in between to bridge the gap between both and create some sort of cross-pollination of the areas, so that there is one policy guidelines or strategy that tackle both. So this is an opportunity to, whenever coming up with policies or initiatives that address both sectors, we need to have collaboration between bringing the intersectoral, we talk a lot about intersectoral collaboration. Here, exactly, more than ever, we need to have sectors working together, sitting together, bringing the evidence from climate and from health together so that there's a unified approach that tackles both health and environment at once. It's not easy, but that's the only way to make it happen, to have both sectors sitting together to really address the food from health and environmental perspective.
Thank you, Dr. Mira. Thank you. As we come to the end of this webinar, I would like to extend my sincere thanks to you, Dr. Mira Al Ghaziri, for accepting our invitation and for delivering such an engaging, timely, and valuable presentation.
Thank you so much.
Thank you, Doctor. Today's session has highlighted the importance of approaching nutrition and food systems, not only through the lens of health, but also through sustainability, feasibility, and policy relevance. We are grateful for the rich insights shared with us. I would also like to thank all our participants for joining us this evening and for your active engagement through the session. Please don't forget to complete the evaluation form once the link is shared. I think Dr. Afachi shared in the chat, as this is required to obtain your CME certificate. We also invite you to stay connected with the Institute of Public Health through our social media platforms and to follow our upcoming webinar activities and educational initiatives. Thank you once again for Dr. Mira, for your time, all participants. Thank you. Wishing you all a pleasant evening. Goodbye. Thank you. Thank you.
Thank you, everyone. Thank you. Bye-bye. Bye-bye.
Thank you.